Thank you all for joining us this afternoon. This is a very important town hall meeting as we're going to review and discuss our COVID-19 response plan. It's important that we have a united front and we're all working together and understanding the rules and procedures moving forward, not only to keep ourselves safe, our job sites healthy and safe, and those people working for us. Okay. So without further ado, I can trust we can all see the PowerPoint presentation. Can I get some thumbs up? Yeah, excellent, wonderful. That's terrific, guys. I'm also going to ask that everybody put their mic on mute, just so that the presenter that's speaking won't have any feedback in the background. Okay, guys? Thank you. Okay, so this is our agenda for today. We'll first start off with a welcome introduction by Bill. He'll give us some background information about COVID-19 and how it's affecting us all. From there, we'll move into our COVID-19 response measures, including a brief background about COVID-19 and how it's impacting all of us. From here, we'll just touch upon the highlighted signs, symptoms, and prevention methods that are available based on the latest and current information from Public Health Ontario. From there, we'll move into our risk assessment, and it's a very important concept because our risk assessment of COVID-19 will dictate how we will respond to future outbreak events, including who needs to be isolated, who needs to be tested, who needs to be quarantined. Next, we'll discuss about the consequences of COVID-19 in the workplace, which is really important because not only can it affect our health, but it can also affect the performance of our job sites, the ability to get other people to join us on site. So we want to make sure that we understand that COVID-19 is a serious virus and it could have long-lasting implications on. From there, we'll talk about the response plans that Harbridge and Cross has prepared. We've developed a number of case scenarios, including what to do when you are dealing with a confirmed case member on site, if somebody has direct contact with a confirmed case member, and steps to take if you have symptoms or illnesses that are similar to COVID-19 but are not, but haven't been confirmed by a test. There will be also additional information about incident investigations and reporting matrices towards the end of the presentation. I do welcome feedback and questions from all of you. So please, if you have any comments or questions, please shoot me a quick email and we'll try to respond to them during the presentation. Any comments, questions, or feedbacks that happen after the presentation, we'll send out an email blast to everyone just to make sure we all have the same information. So I'm going to be passing on the mic to Bill to just give us a few words and an introduction. Bill, when you're ready.
Okay, I hope everybody can hear me. Thumbs up, I guess. Good, excellent. So Michael said it well. I think we just wanted to, as cases seem to be rising, we want to just revisit our understanding of what we need to do going forward. I know we had an incident in our house. We had a close family friend that was in the house that actually tested positive, and my daughter was in high-risk contact with her. And it was, she didn't have any symptoms hardly at all, and it wasn't, physically wasn't a problem. Mentally, it was a big problem because the contact tracing and dealing with the pushback from her friends and her contacts was a little bit mentally strenuous. And I think what I think is important is that we are prepared for going forward at our job sites when, you know, somebody does test positive, because job sites are little communities, as you know, and there's lots of relationships that aren't necessarily positive. And I think hopefully it doesn't, but if we get some positive cases, then there's every chance there could be some serious repercussions in terms of the culture on the job site. So I just wanted to make sure that we were all on the understanding of how we were addressing COVID every day, and then when something, God forbid, happens, that we're able to deal with it professionally and with the minimum amount of agita, if you want to put it that way. So we have been talking about mandatory masks. Some sites have gone that way, and I'm going to put that bug in your ear to think about how that would impact your site and Michael will be talking going forward about making that shift if it's appropriate. Certainly if you on your job can see that people are not able to social distance and aren't, I mean, we really need to address that. And if we have to go to mandatory masks, then I don't think it's the end of the world at this point. But like I say, it's a tough, every job site's different. So we want to try to keep it that way. The other thing I want, and Michael will go into it, is the contact tracing piece of it. If you could just please make sure you have that, because COVID is a reportable injury, and the WSIB repercussions, if it goes through the site, are going to be quite extensive. So when the Ministry of Labor comes, they're going to be looking for the contract or the sign-in sheets. And if they're not well filled out, then there's going to be some repercussions to the company. So, Michael, I think that's all I have to say. I think you've done a great job so far, everybody, and you know, I don't think the sites have been impacted that negatively so far. So keep up the good work.
Well said, Bill. Thank you. So moving on with our presentation, everyone, I'd like to begin by just asking a series of questions, and you don't have to respond to them. They're more of just, you know, thought questions. And I ask, you know, how many of you have been impacted by COVID-19? Have you been infected, or do you know of anyone has been infected, like Bill's mentioned? Do you know of anyone with serious COVID-19 complications? And I want you to think about this and see if it resonates with you, because in Ontario, over 3,100 people have died from COVID-19. Currently, we have just over 1,200 cases that are in intensive care unit, and just under 6,000 people are under hospitalization. And gentlemen, these numbers are going up. Over the last few weeks, the volume of COVID-19 cases have steadily increased, as shown on this graph. You can see here from the first wave in April, you know, we were hovering just below 800, and it seemed manageable. But now that we're in our second wave, I mean, we've already topped the 1,000 mark confirmed cases for a single day. Now, these are some of the biggest numbers we've seen, and they're only growing. Now, we're seeing increased outbreaks in our hospitals. Our kids are returning to school. We're seeing them in our workplaces and our long-term care homes, and there's even evidence of community transmission. So the point is this: COVID-19 is a highly infectious, deadly virus, and we must all do our part to recognize its severity, respect the impact it's having on us today, and to take steps to mitigate transmission. So the question is, are you ready for COVID-19 on your job site? As Bill mentioned, COVID-19 is a reportable event to both public health and to the Ministry of Labor. So as supervisors, as leaders, is contact tracing up to date? Do you have your enhanced cleaning logs up to date? Do you supply or have an adequate stock of PPE, including face masks, hand sanitizers available on your job site? And most importantly, is physical distancing being maintained? So our goal here at the Safety Department at Harbridge and Cross is to get you ready, because believe it or not, COVID-19 is coming. It's a matter of time before we find it in our job sites. So we want to be prepared. So before we dive into some of the prevention methods and some of the control strategies we have here at Harbridge and Cross, I just want to go through a list of the signs and symptoms of COVID-19, because as our understanding of the virus improves and changes, the signs and symptoms also seem to change. So first off, the most common symptoms of this virus, and again, it's just like any other virus, it's determined based on a fever above 38 degrees, a new or worsening dry cough, or shortness of breath. Now, some of the new, less common symptoms that we are learning about includes a sore throat, diarrhea, loss of taste or smell, a rash on your skin, or the discoloration on your fingers or toes. Now, the more serious symptoms include difficulty breathing, chest pains or pressures, and the loss of speech or movement. Remember, COVID-19 affects our respiratory system, and breathing is an important function of living. So how do we prevent the spread of COVID-19? Well, for many of us on our sites, we are implementing a lot of important actions, including enhanced hygiene. or using soap and water or the alcohol-based hand sanitizers, the spray bottles we have on our job sites. Enhanced cleaning measures. We're wiping down our common area surfaces, hand railings, and lunchrooms at least twice a day. Now, it's important that we're able to show this by making sure that our log reports are up to date and that reflect that we are doing the required cleaning. Physical distancing, which is paramount. 2 meters or more between each and every one of us. This way, the virus won't jump to us. Making sure that our contact tracing is up to date. Members, visitors, workers coming on our sites must both sign in and sign out, and they must answer our COVID questionnaire. We want to make sure that sick people aren't coming onto our job sites. Wearing a mask is also effective. Cough and cover your nose and mouth, or sneeze into your elbow. And again, if you're not feeling well, stay home. So again, wearing a mask saves a life. Wearing a mask, cleaning your hands, keep a safe distance. These are preventative measures that will stop the spread of COVID-19, both in our communities and on our job sites. So the next thing I want to turn your attention to is our risk assessment. Now, the risk assessment is going to be an important tool in determining the steps that we take if we come across COVID-19 on our sites. If we're in close contact with others, it will determine what steps to take, including whether or not we should quarantine, whether or not we need to get a test. So the risk assessment is based on the interaction between a confirmed case to a non-case member and the susceptibility of that healthy person contracting COVID-19 based on a series of masking and social distancing. Now, before I jump into this chart, I just want to remind everyone, simply wearing a face covering mask will not prevent you from getting COVID-19. It will not. What it does is that it prevents those little droplet particles that we breathe out from going around our space and contracting other people. Okay, so that's the whole purpose of the mask, keeping our germs to ourselves. So in this first column here, what is the likelihood of getting COVID-19? We start from a very high probability, a very strong likelihood of contracting the virus, to a very low probability or likelihood of contracting the virus. And it's in the sweet spot that we want to live. So in the second column, we have the infected COVID-19 case, followed by the healthy person, and again, introducing both masking and social distancing. So in the first example, I hope it's very clear that if you are within 2 meter distance of an infected person and neither of you are wearing masks, guess what? There is a very strong likelihood that you will catch this virus. This virus is extremely infectious. We see that once we start introducing masks, especially on the infected person, the risk drops from a very high to a high category. Now, the reason why we're still in the high category range is because we're not maintaining social distancing. That 2 meter distancing is important because if somebody breathes out, these particles will not come to you. You're beyond that threshold. When we move into a more moderate level, you'll see here that again, the infected person is wearing a mask, but because we are maintaining this social distancing, the likelihood of us contracting the virus has dropped significantly. And again, once we incorporate masking, both on ourselves and the infected person, and social distancing, we move to more of a low and very low scenario. And that's the sweet spot we want to be in. So let's just review our current masking policy. If you go into your COVID-19 workplace policies, the current policy is this: face masks is only required when you're unable to meet 2 meter physical distancing. What we would do is sort of put a bug into your ear is, in order to improve or lower our risk assessment and the potential exposure to this deadly virus, we recommend this: masks be on at all times. This includes in the workplace, on site. When you're driving with another person, if you're in the lunchroom and you're not eating, put on a mask. Or if you're in a meeting greater than 15 minutes, we want you to wear a mask. Now, this isn't an impossible task. And in fact, I just want to recognize those supervisors who've actually taken a leadership role and introduced mandatory masking on their job sites. And it's been met with tremendous success. So in these particular cases, the supervisors held a safety stand-down meeting, got the entire job site together, explained the problem very simply. This is the problem. These are the types of solutions, and asked, where do we go from here? And believe it or not, your job sites will come on board. members on your site are going to recognize how dangerous and how infectious this virus can be. And they all have families of their own. They all have elderly that they care for, and they want to keep everyone healthy. So again, the message is this. We want to throw the bug in your ear. If you need help introducing mandatory masking on your job sites, the safety department is here to work with you. We will put together a plan to communicate this message in an effective manner to get buy-in, because it's only with true buy-in are we able to get success. So the consequences of COVID-19, again, we've already established, masking, physical distancing is important because it's going to get us to that lower risk threshold. So what are the impacts if COVID-19 comes to my job site? Well, first off, as Bill mentioned, this is a reportable incident to the Ministry of Labor, and we have within 4 days to complete our report. Supervisors expect a visit from the Ministry of Labor. If the event is uncontrollable, or if you're on a small workplace, there's a very strong likelihood that we're going to have to shut down the job site for at least 14 days and top to bottom clean. And this is going to lead to project delays. Quarantine, a minimum of 14 days for high-risk members. So for those members on site who don't want to wear a face mask, who don't want to use social distancing, guess what? We're automatically going to ask you to self-isolate and quarantine for that 14-day period. You're a high risk. Also, this can lead to a decreased worker participation or trades unwilling to come to your job sites. If trades know that there's outbreaks taking place on our job sites, that we're not doing everything in our power to stop the transmission, why would they want to come? Why would they want to expose themselves to that kind of liability or that kind of health risk? And guess what? That's going to lead to more project delays. And of course, you can get infected. You can infect others, those that you care for, those that you love for. So the message is this: COVID-19 is a bad thing to have on our job sites, and the consequences can be severe. Okay, so this takes us to the next couple of slides that are going to talk about some cases or steps for us to take if we do encounter these particular scenarios. Okay, so just bear with me. In our first case, we're dealing with a confirmed case of COVID-19 on the job site. So what does this mean? Person here has had COVID-19 via a positive test. The worker is to notify their supervisor and self-quarantine for at least 14 days, and they may only return to site with a negative test. Now, this negative test, this is dependent on the Harbinger Cross. We reserve that right to ask for that test, but it's not mandatory within that policy. So in this first example here, you have a worker, a drywaller, let's say. He's on site. 12 o'clock rolls around and he's not feeling well. He's got a fever. He's coughing out his nose. What do? Well, first off, you ask that worker, stop what he's doing, pack up his tools, and go home for the day. He's unwell and we don't want him on this job site. He's going to go home and he's going to monitor his symptoms for at least 24 hours. As a supervisor, we have a responsibility to notify workers in direct contact with the symptomatic worker to monitor for symptoms. In this case here, we have no reason to believe that this worker has COVID-19. They could have a seasonal flu. They could just have a bad cough. Maybe they drank water wrong, whatever the case may be. But nevertheless, we're going to notify members who have been working near this person to monitor for symptoms, and we're also going to clean and disinfect his work area. The next day rolls around. That drywaller is still not well. It's been 24 hours and he's still sick as a dog. Guess what? You're staying home. You're not coming back to the job site. And in fact, we're going to ask him to get tested. As supervisors, what we want you to do is expand this notice to the rest of the job site and ask everyone to monitor for symptoms. Again, if we're wearing masking and we're maintaining our physical distancing, there's no reason to create a panic or an alarm. But this worker will need to get tested. Now, if his test results are negative, great, that's what we want. He can return to work when he's ready to do so. But if his test results are positive, he's not coming back to our job site and he's going to have to quarantine for the 14-day period. Additionally, supervisors, you are required to use your contact tracing list and notify staff members that may have come in contact with the infected worker. Workers in the high-risk group that we mentioned earlier that have been working with this other drywaller without masking or without proper physical distancing are high risk. They have to quarantine for 14 days. We don't want them back on our site, okay? After that 14-day period, if they're well, then they can return to work. And again, in some cases, Harbinger Cross may ask for a negative test result. Not mandatory, but we as the company reserve the right to ask for that at any time. Also, as just a side note for a confirmed case, for some of our project managers, again, we encourage you to try and use Zoom, Teams, any other video calling service to hold your meetings. But we do recognize that there are times where surprise meetings will fall on us, where it will require us to sit in a room with either a subtrade or somebody else. Again, masking and physical distancing is very important because this is what happens when we're not following those protocols. So in this particular example, we have a meeting taking place. It's greater than 15 minutes, and we learn afterwards that the member has been diagnosed with COVID-19. In this video, we're going to go straight to our risk review chart. And again, if we're wearing masks and maintaining that social distancing, then we're going to find ourselves in the low and medium risk category, in which case here, all we need to do is just monitor for symptoms and we can return to work. However, if we are not wearing masks during the meeting, or we did not, and also did not maintain physical distancing, then we are in a high risk group and we have to automatically quarantine for 14 days. In this case here, a test result is irrelevant. We don't care about that. You're in the high risk group. We want you to quarantine for 14 days. Return to work once all the symptoms are clear and you're beyond that 14-day period. Okay, so again, project managers, try to use your video calling. Superintendents, I know sometimes you have some site meetings. Let's try to use video calling whenever we can. And if we cannot, masking and physical distancing have to be maintained. Because if we find ourselves in these situations, we're going to have to quarantine right away. In our case number 2, a direct contact. So this is a scenario where a person who has had direct high-risk contact with a confirmed COVID-19 person. And again, I remind everybody, high risk is based on our risk assessment. The contact means that there is no face protection and there is no physical distancing. Now, direct contact could be through a variety of avenues. It could be our immediate family, our co-workers, or people in our social circle. Again, if we're not practicing masking or physical distancing with our family members and they catch COVID-19, guess what? We have COVID-19. Or we're going to take the presumption that we haven't. Following the flow chart, again, if you're confirmed to have COVID-19, we want you to go home and monitor for symptoms. We're going to review the risk review. If you fall within the medium or low risk group, we want you to monitor for symptoms. So, for example, let's just say part of your social circle, you're going to visit your sister-in-law, and it was over a weekend, she's got the virus, you learn about it afterwards, but during your interaction with your sister-in-law, you guys both maintain masking and the physical distancing. Even though she's contacted COVID-19, because you follow those proper practices, your risk category is medium and low. So that's why you just need to monitor for symptoms, and then you can return to work. If it's your wife or your children and they contract the virus, well, I don't think we're using masking or social distancing in front of our children and our wives. In that particular case, we're automatically high risk and we're going to ask you to quarantine for 14 days. Again, a testing is not required in this case. You're part of the high risk group. You automatically need to be quarantined and only return to work after your quarantine period. Now, we do recognize that sometimes that even if we're in a medium or low risk scenario, symptoms could return. And if that happens, we automatically want you to get tested. Isolate yourself, remove yourself from the work environment and get tested. If the test is negative, great. Come back to work when after that 24-hour period. If the test is positive, then again, we want you to quarantine for 14 days and return to work. Supervisors, again, once we learn that we're dealing with a high-risk individual, use your contact tracing list to notify staff members that might have been in contact with that worker, and anyone else that also falls within the high-risk group must quarantine for 14 days, okay? And then in our last case scenario, we're dealing with a scenario where illness is not confirmed by a COVID-19 test. So in this particular case, a person who exhibits symptoms of COVID-19 but is not confirmed to have had a COVID-19 positive test, could be seasonal flu allergies, fever above 38 degrees, a new or worsening cough, or some sort of shortness of breath. Some of the common symptoms we've recognized at the beginning of this presentation. In this case, these are the steps we will take. The worker develops these COVID-19-like symptoms. We're going to ask them to go home and monitor for symptoms for 24 hours. Supervisors, we need you to notify all workers that have worked in direct contact with the symptomatic person to monitor for symptoms and to also clean and disinfect their work area. After that 24-hour period, if the symptoms are gone, great. We ask that worker to return to work. But if the symptoms remain, again, we want them to stay home, and then we want them to get tested. We want to be absolutely sure it's not COVID-19. If the test is negative, great, they can return to work. But if it's positive, then we want them to quarantine. And again, using our contact tracing list, we're going to notify all those workers that might have had contact with that individual. Anyone falling within that high risk group has to quarantine for 14 days. Okay, so moving towards the end of the presentation, we just have additional feedback and notes, and includes how do I report a case of COVID-19? So again, if you are diagnosed with COVID-19, or if you're in a high risk group, direct contact with a person confirmed to have COVID-19, we want you to take the following steps. First off, the incident has to be reported to your supervisor, and we need the supervisor to report it to both the safety department and to senior management. Why do we need to be involved? Because we have to start putting together an incident report. Some of the information you can start gathering includes, the incident date and time, the reported date and time, because sometimes those periods could be off or different. We need to know all the parties involved. If it's one member of the drywaller crew, well, we'll need to know that person and all the other people he has had contact with. We need to identify the location so that we can isolate that area and start cleaning it up immediately. We need to know the incident details, the corrective action, and the preventative action. So oftentimes the corrective action could be that we asked the worker to go home, we contacted everyone in that immediate area, and then we also did a top to bottom clean down. That's part of our corrective action. It's important that we identify that, because that's what Ministry of Health officials will be asking of us when we submit our investigation to them. We also want to identify preventative actions, sort of take a step back and do some lessons learned about the situation, better, more proactive measures in place. Like I said, Ministry of Labor will have to be contacted and notified. And in some cases, depending on the complexity of the scenario, criminal investigation could take place. As in the case we heard over the news about the teacher who caused the school to lock down over a week because, again, they failed to take their temperature, they failed to complete the COVID-19 questionnaire, and exposed that entire school and the student population to an undue harm. And next, we're going to want to make sure we follow up with contact tracing and then notify our clients of the situation. You can find more information of this inside your COVID-19 workplace policies that are available on site. So this concludes my portion of the presentation. Again, if you guys have any questions or comments, let's please take this time. You can unmute and ask us these questions. And if I'm able to give you an answer right here and now, I'll do so. And if I can't, I'll be sure to send an email communication blast to everyone. So, thank you for your time. And I open the floor up to all of you. Okay, so I don't see too much interaction right now. Rick, do you have something to say?
I was just thinking, can you hear me okay?
Yeah, I can hear you, Rick.
I'm just thinking, if the numbers are going to continue to increase, why don't we just make it mandatory on all job sites that you have to wear masks?
Thank you, Rick, for the question. Right now, we wanted to throw the filler out there. We wanted our supervisors to assess their situation, interact with their job sites, and to get some feedback and buy-in. Ideally, I would like to make it mandatory across all of our job sites, but we believe the best way of getting good buy-in, good feedback, is creating a communication dialogue. So again, starting with our supervisors, finding out where their heads are at, getting the job sites involved, and putting together an effective plan. Like I mentioned, this is a strategy we employed recently on a couple of our other job sites, and it's working beautifully. Workers are coming in every day with masks on because they're part of that buy-in process. And we believe if we just shove it down everyone's throat, then we're going to deal with a lot of non-compliance issues. And that's not what we want. We want everyone to buy in as a team. We want everyone to know that we are in this together. Does that answer your question, Rick?
Yeah, fair enough.
And again, Rick, as a supervisor, if this is what you want on your site, the safety department will be there later this afternoon with the toolbox talk, with the safety stand down plan. We will get everybody involved.
I think going forward on this particular job site, there's not that many people left. It's a pretty small bubble, and we all seem to be working with the same group at the same time. But as we start something new here, if in fact we do start at the next phase of the LAO, then I think I would want to make it mandatory on this particular job site because they're going to be in a much smaller space.
That is a terrific leadership role, Rick, and we will support you in all of that.
Thanks.
Thank you.
I want to say that for us, we would love it if every job site had mandatory masking. But I mean, as Michael said, ramming it down people's throats sometimes is not the right way about getting to that point. But we definitely would like to get to that point. And if you guys are on board, then we're going to do everything we can to help you to get there.
Oh, I'm on board.
I just had a question if there's anybody that's had any contacts on their job or close contacts, if there's anything at all, or we've been extremely lucky.
Nothing on site, but in a personal note, we've had a couple of contacts in our personal family. So
Anybody else?
None on site, Bill. Again, personal contacts, but not on site. I mean, here at the hospital, we are 100% mandatory masks at all times throughout the entire job site. So I support 100% all the time.
yeah.
Thank you for that, Jeff.
Excellent.
Okay, I don't want to single anyone out. Again, if questions do arise, please send an email to the safety department, and we will, of course, communicate that to the rest of our team. Bill, is there anything else to add?
No, just thanks again for everything you guys do.
Yeah, I want to thank you all for joining us on this Friday afternoon. Again, we're all in this together, and we appreciate all of your support moving forward. Thank you, guys.
Thank you very much.
You guys have a
Thank
good
you.
afternoon and a great weekend.
You too.
Bye, guys.
Thanks, guys.
Okay, I'm going to close the meeting, everyone. Thank you for your time.